Hi, skin friends. Welcome back to Skin Tips by Cyphora. I'm so happy to be here. I don't know about you, but guess what? Today we are going to be discussing something that does not get enough attention. A topic that does not get enough attention. But funny enough, do you know what? Plenty people have this condition that I want to talk about. So today, I'll be happy if you can sit back and do not fast forward this video so you could get all the tips and so that your glow up will be excellent.
Okay, guys, today we'll be discussing on hypopigmentation. If you have white patches on your skin or lighter spots on your skin that do not just want to blend in with other parts of your skin color, do well to hit the like button and subscribe to this channel because this is the kind of skin talk that you do not want to miss. So now, what is hypopigmentation? Hypopigmentation can simply mean loss of skin pigment. Yes, the thing that determines your skin color. I'm fair, I'm chocolate, I'm dark skin, I'm this, that thing that determines your skin shade is pigment. So when you have hypopigmentation, it means that there is a loss or absence of melanin, of pigment, whatever you want to call it, on that area of your skin. So I hope you understand. Yeah. What are the causes? Okay, before we go to the causes, how can we identify hypopigmentation? We already defined that hypopigmentation is a loss of pigment on your skin. I already explained what pigment is. So how can you identify this on your skin or on other people's skin? First, you need to look out for a white patch. So there are some part of your skin that will be having dots, but the dots are white. When you have the dark ones, it is hyperpigmentation. When you have the light white ones, it is hypopigmentation. So yes, the first way to identify it is white patches. Another one is a lighter part of the skin after you recover from acne or eczema. Yes. Then the third one might be an autoimmune condition like vitiligo and other, condition that people might be born with that might lead to hypopigmentation. So then another way you can get hypopigmentation is by the use of harsh products that have harsh chemicals, bleaching products. Those type of products can give you hypopigmentation. Then the last but not the least reason that is also very common, as in the very fast way you can get it, is by abusing steroids. Those cream that contains hydroquinone. People run away from hydroquinone. Hydroquinone is not a bad skin ingredient, but you must use it with the advice of your dermatologist, esthetician, or your skincare therapist. So, overuse or abuse of hydroquinone can also give you a loss in your skin pigment. So, from the causes of this hypopigmentation, you can now tell from your history, or will now know what caused your own hypopigmentation. So now, for the part that you are here for, which is the treatment of hypopigmentation, how can you deal with it? First, you need to identify the cause. I've mentioned the causes of hypopigmentation, the things that might lead to hypopigmentation. First, you need to do what? First, you need to identify the cause of your hypopigmentation. Is my hypopigmentation fungal? Is it by use of bleaching products? Was it an autoimmune condition? So all those things you will need to identify first. After identifying the cause of your hypopigmentation, you will need to start using gentle skincare products only. Avoid any harsh creams, any harsh scrubs, any harsh serums, acids, anything that will lead to the depigmentation of your skin color. You will need to avoid it and use only gentle skincare products. Another step of how to treat hypopigmentation is to look out for ingredients that aids repairments, that skin repairments. Example of ingredients that can aid barrier repairs and cellular turnover are niacinamide, vitamin E, ceramide, panthenol. All those ingredients are what you should look out for after identifying the cause of your hypopigmentation, entering the gentle cleanser era, and then you now look out for the ingredient that you're supposed to use. The fourth stage is to be patient with your repigmentation. Yes, it will take the melanocytes, it will take the skin cell a lot of time to recover, like to bring back your skin pigments. So you need to be patient with your repigmentation. Sometimes the skin can take months to rebuild. So do not panic if your hypopigmentation might look like it's not working. So you just have to be consistent and keep using those repairing ingredients or product that aids skin barrier repair and cellular turnover. So those are the steps on how to treat your hypopigmentation. Then the last but not the least is sunscreen. You cannot be treating hypopigmentation and not wearing sunscreen. A sunscreen is non-negotiable because when you're entering hypopigmentation, if you expose your skin to the sun, it's going to slow down your healing process. And you know, exposure to sun without protection and worsen uneven skins. So now I've mentioned how to treat schools. What are the don'ts? Sorry. What are the don'ts? What are those things you shouldn't do in the process of treating hypopigmentation? One, never try to bleach the other part of your skin to blend into the hypopigmentation skin area. So please do not bleach your skin. Hypopigmentation might take a lot of time, so I will advise that you exercise patience and be consistent with your skincare products. Always go with the advice of your skincare therapist, your esthetician, or your dermatologist. So guys, have you ever dealt with hypopigmentation? Share your story in the comment section. Your story might help someone out there. Thank you. I'll see you in the next one. Bye guys.